Breast cancer, majority is curable.
That's a good news.
Yes, like you said, okay, stage 0 breast cancer is called DCIS.
Hai, saya Ira dari Ohana Medical Group. Hari ini saya bersama Dr. T. Messi dari Subang Jaya Medical Center. Beliau adalah seorang dokter bedah payudara dan onkoplastik yang sudah sangat berpengalaman. Dr. T, can you share more about yourself?
Hi, I'm Dr. T. I work in Subang Jaya Medical Center and I'm a breast oncoplastic surgeon, meaning I am a breast surgeon who deals with all breast diseases, including cancer and non-cancer, and also reconstruction after the cancer surgery.
So you do the reconstruction altogether?
I will do the reconstruction during the cancer surgery or some of the non-cancer but very large tumor.
Oh, okay. So today we are going to discuss about the myth about breast cancer. So there are several questions I want to ask you.
Sure.
They say if I can choose whether I want to do ultrasound or mammogram. So actually, is it okay to choose one? Because I know that mammogram can be quite painful, right? Yeah.
So actually, the gold standard for breast cancer screening is mammogram.
Oh.
But usually when it's done in young ladies, less than 40-year-old, it is difficult to see. Because the breast is still very dense, very tight. So when less than 40, the best ideal imaging is an ultrasound.
Okay.
Above 40, ideally, is a mammogram. So you talk about the pain during the mammogram.
It's terrible,
yes,
actually.
it's actually not very. The latest mammogram is a 3D mammogram. So 3D mammogram compression is only 20 seconds. Okay. And the compression is not as painful as the traditional older mammogram. So it is still acceptable pain.
Okay. So I know that mammogram you need to do it after 40, right?
Correct.
Yeah. So is there any occurrence where the breast cancer happens before 40?
Yes. So when we talk about more than 40, we are talking about screening, meaning the lady do not have any breast problem. So it's just like a regular checkup. Yeah. But if there is a breast lump or if there is breast cancer, even at 20s, 30s, you will need a mammogram. Because that will be a baseline. So that after that we can follow you.
So if you feel a lump, you need to get both ultrasound and the mammogram as well.
Ultrasound first for less than 40. Then more than 40, ultrasound and mammogram.
Okay. So the second myth, women who breastfeed will not get cancer.
Breastfeeding is protective.
Okay.
Yeah, so it reduces the risk of breast cancer slightly, but it does not prevent. So you can still get breast cancer even if you breastfeed, but it has a little bit of protective. It reduces a little bit, but doesn't mean that if you breastfeed, you will not get cancer.
But I also hear that some ladies who just breastfeed then was detected with breast cancer.
There is also ladies who get breast cancer during pregnancy or during breastfeeding. That is actually the highest cancer in breastfeeding and pregnant lady. Breast cancer is the highest cancer because this age group, the risk of other type of cancer is lower. But breast cancer is highest in this grade group. Not because they are breastfeeding
usually,
yes, but that the highest, the cancer that is there, if detected, can be detected during pregnancy or breastfeeding. So if anybody feels abnormal, there's a lump in the breast that is not related to infection, then it should be checked.
Okay. But then it's kind of hard to tell the difference between the lump and the the milk.
Engorged breast, right?
Yes.
So if engorged breast after breastfeeding, it should reduce, or it should disappear after massaging or when after lactation. But If it's persistently there, a hard lump there, then at least an ultrasound should be done.
Okay. It will ultrasound will be
Can
able to
be able
pick
to tell us whether there's any abnormal looking tumors or not.
up. Okay. So the third myth, women with smaller breasts is have lesser risk of having breast cancer.
That is not true.
Not true.
When we talk about not the size, when we talk about breast cancer risk, the risk is the more dense the breast, the higher the risk. So density and not size. So it's the
small
character of the
breasts can
tissue.
be dense as well.
Small breasts can be very dense, also can be not dense. So it's not the
okay.
size of the breast or the cup of the breast.
So the fourth one, I have no unusual lumps in my breast, so I definitely don't have cancer. So I don't need to worry.
Yeah. So the reason why we said, okay, we do annual checkup, that's what
Yeah.
we call screening. Also, you don't feel like you have diabetes. But you should go and check every 1 to 2 years,
Yes,
because it's not, we don't want to wait until you have complication or when the disease become more severe. So there are times when we check stage 0 cancer, stage 1 cancer.
You can't really even
You
feel
cannot,
the
anything that is around less than 1 centimeter, when you feel by hands, it's not accurate. So we want to do something whereby we check or we send for testing or imaging, X-ray, mammogram, ultrasound of the breast to detect cancer as early as possible.
Okay. And the fifth myth, neither biopsy will cause the cancer to spread. This one's very
That is
often.
a very
Yes.
good myth to debunk.
Okay.
It's a myth.
Yeah,
because
it's a myth.
it's a common question when people say, okay, I say, oh, it looks suspicious, I need to biopsy.
Yeah.
Then the following question is, oh, I don't want biopsy because it will spread the cancer.
Yeah.
That is not true. Because for breast, we are talking about breast lump, the only way we can confirm whether it's cancer or not cancer and the type of cancer is through biopsy. And biopsy doesn't cause the cancer it doesn't trigger the cancer or doesn't cause spread.
It doesn't have any tracing as well?
It doesn't.
It doesn't.
We can remove all those during operation, so do not worry about that.
Okay, so it's safe to do biopsy.
Correct.
If
It's a must do.
It's a must do.
It's a must do if we look and we find that there's a suspicious lump in the breast.
So do you actually remove the lump first, then biopsy, or
No,
which
if we
one?
follow the guidelines, right, it's always biopsy first before surgery.
Why is that? What's the reason?
Because biopsy is non-surgical procedure. It's a simple procedure, very low risk, but the management may change. So now breast cancer and non-breast cancer, the surgery type is different. We try not to do many times surgery. So let's say if we take a lump, we find a lump and we remove that lump and found out later on that this lump is cancer. Then we have to do second operation because cancer surgery and non-cancer surgery is
It's
different.
different.
Yeah.
Okay, I think that's something that a lot of people need to know, that
Correct.
there's a difference between surgery for cancer and not
Correct.
cancer.
Correct.
Yeah. And the next myth is taking too much soybean will cause breast cancer.
This is also not true because if you look at evidence, long studies, soybean estrogen is not the same as human estrogen. Soybean estrogen is what we call phytoestrogen or plant estrogen. It doesn't work it doesn't react like a human estrogen. So there's no strong evidence to say that soybean causes breast cancer.
Okay. Because in Indonesia we eat a lot of soybean products.
Like especially vegetarian.
Yes,
so
yes.
that's the only
Yes.
source of protein they have, but it doesn't really cause, or it does not have evidence to cause breast cancer.
Okay.
Yeah.
All right. The last myth that I have today, if I have no history of breast cancer in my family, I definitely will not have any breast cancer at all.
Also a myth.
So
Yes.
sad.
Yes, it's also a myth because majority, or I would say almost 80% of newly diagnosed breast cancer does not have any family history of breast cancer. So it will say, if in conclusion, that is just majority of people do not have family history.
Yeah.
Yeah, so that's not
Yeah,
true.
so you still need to go for checkup and
Screening is for
screening.
everyone.
Yeah.
Regardless of family history. But sometimes some people with a very strong family history of breast and
Does
ovary
tend
cancer,
to
then the interval between one scan and the next year will be shorter. So let's say you do not have family history of breast cancer, then maybe you can start mammogram at around 40 plus and do every 2 years. But if you have very strong family of history of breast and ovary cancer, then the mammogram should be done every year.
Okay.
And it should start
Earlier
earlier.
age.
Correct.
Okay. So how old do you want them to start? If they have family history, how old do you want them to start screening?
If you have genetic mutation or family members with BRCA gene, then the screening starts at 30-year-old.
Okay.
But 30-year-old, we may talk about ultrasound and MRI rather than mammogram.
Oh.
So it's a different group of patients, because if these people carry genetically mutated gene that has higher risk of breast and ovary cancer, so when we talk about that, we talk about BRCA1 and 2 gene.
Yeah.
Like
the
Angelina
Angelina
Jolie. Yes. So if you have this gene, the risk of carrying breast cancer or having breast cancer is higher than not getting breast cancer. So the screening starts at 30-year-old. And when just now we mentioned less than 40-year-old mammogram may not be very accurate. So this group of patients between 30 to 40-year-old, you ask them to go for ultrasound and MRI.
MRI. Okay. The last question, why do we always have to detect early? Is there any, what's the difference in the management if we can detect it earlier?
Okay, breast cancer, majority is curable.
That's a good news.
Yes, like you said, okay, stage 0 breast cancer is called DCIS.
Yes.
Okay, the survival in 5 years is 100%. Whereas stage 1, the 5-year survival is 95%. Stage 2, you go down to 80%. Stage 3, maybe 70%. But stage 4, 20 to 40%. So the earlier you diagnose, the better. The survival outcome is better. And also it may change the treatment.
Yeah.
You may not need so many type of.
Maybe surgery is enough.
Surgery is
for
enough, or
earlier stage.
radiotherapy and chemotherapy. The management may be different.
Okay. So for screening wise, we should come and see you first as the breast surgeon, right? Okay, can.
So for screening, even if you don't see a breast surgeon, you can always do screening, ultrasound and mammogram.
The health screening.
The health screening center, anywhere you are. And then if there's any problem, the doctor should refer to a breast surgeon. Then at least we can guide the further management.
Thank you so much,
No
Dr.
problem.
Tay.
Thank you.
Thank you.
Thank you.